Hey everyone, thanks for tuning in and welcome back to Effective Exercise. Stephen here with Team Euphoric, and today I'm going to be discussing how both practitioners and patients can optimize their health and performance by going over the CHEK Totem Pole. The second item on the CHEK Totem Pole is the Temporomandibular Joint, or TMJ. The TMJ connects your jaw to your skull and plays a significant role in chewing, speaking, and breathing. Dysfunction in the TMJ can lead to headaches, neck pain, and even postural imbalances. Ensuring the TMJ is functioning correctly can help alleviate these issues and improve overall health. Now I'm going to be taking you through some TMJ assessments to assess the client or patient's TMJ, or the temporomandibular joint. The first thing that we are going to do is have them make some jaw movements to see how the alignment is. So what you could have them do is elevate and depress the mandible by opening wide and closing the jaw shut. And you want to see as they open, or does it go in a straight line, or are there any deviations? A lot of times what you're going to see is when a patient opens their mouth, there's going to be a little bit of a lateral deviation, and then it's going to come back to the center and close up. And then same thing on the way when they go to close, you might see something where there's a lateral shift and then it comes back to center. So you want to assess that. The other thing that you could do to assess is palpate. So you would go right at the temporomandibular joint, so right where the temporal bone meets the mandible, and you would put your fingers right inside of that little gap and just have the patient or client open and relax their jaw and see if you could notice a difference from one side to the other. Do you notice that one side has more tension? Do you notice that in one side maybe there are some adhesions that you could work on? But go ahead, give those a try. Those are just a couple of basic assessments that you could try. I'm not going to go over every single assessment because that's going to take way too long. However, if you are a channel member, check out the assessment series playlist. You'll have access to 120 assessment videos. And if you're not a channel member, consider becoming a member. It's only $5 a month, and you'll get instant access to all of those different assessment videos. Next, we're going to go over some exercises to help improve TMJ function. The first thing that you could do is just some basic relaxation exercises. So for the relaxation exercise, you would have the client or patient or yourself take the tongue, place it up against the roof of the mouth, against the top set of teeth, and you would have them open their mouth while keeping the tongue pressed up against the roof of the mouth, and then close the mouth. For this one, you would want to hold that position for 5 to 10 seconds, and you would do that anywhere from 3 to 5 minutes, or until you notice that you start getting a little bit fatigued. But go ahead and you could work on that exercise. The second thing that you could do is some jaw stretching exercises. So for basic elevation and depression, you could have the client, patient, or yourself open up the jaw as wide as possible and hold that for 10 seconds. And once again, you can do that for sets of 3 to 5 minutes. And then another stretch that you could do is for lateral deviation. So for lateral deviation, you would have the client, patient, or yourself open the jaw as wide as possible. And then while the jaw is open, you would shift it to the left and hold that position. And then you would also do it on the right side. So you would open your jaw as wide as possible, shift to the right, and then hold that position for 5 to 10 seconds and do the exact same thing. And those will be a few stretches that you can incorporate. And then a terrific exercise that I absolutely love for TMJ dysfunction is the TMJ ELDOA. I'm just going to use a personal anecdote, but myself, I used to have a lot of clicking in my right TMJ, and I've had that problem for years. And then this was maybe about 5 or 6 years ago. I ended up taking the level 4 ELDOA course. And in that course, we were taught the TMJ ELDOA, and I ended up doing it. I only did it one time ever. And after that, all of the clicking completely stopped in my jaw. So this is a great one. What you would want to do is you are going to get a small little dowel that is about anywhere between 6 to 8 millimeters, depending on your height. And then you would want to cut it to the length that it fits behind the last set of your molars. Then you would place this right in your molars and you would clench down. Then to actually initiate the ELDOA, what you would do is you would do it in a seated position, and you would want your elbow propped up on some type of table. Once your elbow is propped up on the table, you would place your chin on the actual hand. And then for this one right over here, you would want to keep your chin retracted. So you're tucking the chin in, pushing the crown of the head up. You're looking down with your eyes to place the dura mater under tension. And then you are simultaneously pressing down with your chin while clenching with your teeth on the actual short little dowel. Now, for this one right over here, a few important things to note. You don't want to press up with your palm. You want to press down with your chin. So imagine that you are just sinking down deep into it to get that pressure, and you're also biting at the same time. And again, you want to make sure that when you are getting the dowel, it is at the last set of the molars. And you want to cut it roughly the length of molar to molar. When you are cutting the dowel rod, you want to make sure that you are using some type of soft wood because you don't want it to crack in your mouth. But those are just a few different exercises. For more exercises, regardless of whether you are a member or not, check out my exercise series playlist. There are over 700 different exercise videos. But for now, we are going to move on to the next item on the CHEK Totem Pole. Thanks for sticking around until the end of the video. Be sure to like, share, and leave a comment as it'll help the algorithm. And if you enjoyed the content, show your support by subscribing to the channel by clicking on the icon in the bottom right corner. And if you really want to show your support, then consider becoming a member by clicking on the icon in the bottom left corner. These new high quality videos aren't cheap to edit, and the $5 membership will really help with the video editing budget. You'll also get access to a ton of exclusive perks like early access to videos and this program design lecture playlist in the top right-hand corner. And if you want to learn how to do a one-armed pull-up, then check out the playlist on the top left corner.